Hello, GHT Squad, and welcome back to another episode of The Gut Honest Truth. The Gut Honest Truth is a functional medicine practice based right outside of the Washington, D.C. metro area. For anyone who is new to us, welcome. I am your host, Katie Morra. I am both a registered dietitian as well as an Institute for Functional Medicine certified practitioner specializing in gut health. The Gut Honest Truth brings you honest and witty conversations around hot topics in healthcare. Now let's jump right into today's episode. I have a very special guest for y'all today. Her name is Jennifer Goldstock, and she's a nurse practitioner who specializes in the treatment of tick-borne illness using a functional medicine-based approach. She also specializes in treating other areas such as autoimmune disorders, thyroid, digestive disorders, as well as bioidentical hormones for both men and women. She has extensive training through IFM and is currently completing her fellowship through A4M, which is the Academy for Anti-Aging Medicine. She holds a seat on the board of the Lyme Action Network and has been mentored by some of the best Lyme literate MDs in the world, including Dr. Horowitz. Jen is the co-owner of Synergy Integrative Health and Wellness in Latham, New York, my hometown, and that is where she sees her patients. So welcome, Jen. Thank you for being on here, and why don't you tell us a little bit how you got into both Lyme treatment, especially, because that is what today's hot topic is going to be, as well as functional medicine.
Thanks, Katie. It's so great to be here. Thanks for having me on. So my Lyme journey was pretty interesting. I always had an interest in integrative medicine. I have a history in worked in oncology for approximately 10 years. Initially, my journey into medicine started during the kind of onset of the HIV/AIDS crisis, and I was losing a lot of friends and decided I wanted to do more than just sit by their bedside. And, as I watched a lot of them pass away. So I embarked on a journey in medicine. And what I found was that the approach that was being used to, for instance, when I was working in oncology, we were I did a lot of work on a bone marrow transplant floor, and I would see patients receiving treatment and fighting off cancer, and we were feeding them high fructose corn syrup fruit cups and brownies and pancakes with high fructose corn syrup, and it just went against everything that I believed in personally. So I really wanted to pursue more of an integrative functional medicine career. And when I landed up here in upstate New York, I took a job with a integrative medicine practice. And I thought it was just going to be this nice little cushy job where I talked to people about, eating organic carrots and here's some vitamins and supplements you can take. And what I didn't realize was that because there was such a dismissal of patients with chronic Lyme disease, they sought treatment at this one particular center where I worked because it was really the only place where they were being heard and being treated. So when the physician that I worked for at the time asked me if I knew anything about Lyme disease, I said, well, yeah, of course I do. I mean, it's, we had 5 minutes of it in nurse practitioner school. So I thought I knew enough. Well, I didn't realize what was about to come upon me. It has certainly been a crazy journey, and there was a huge learning curve, and it's resulted in kind of becoming a passion for me, and it reminds me a lot of what happened in the HIV and AIDS community back in the 80s and early 90s. Kind of a denial and a dismissal of what was really happening in that community.
Yeah, Lyme. I treat Lyme patients, not specifically the Lyme, but a lot of, the immune and gut support around that.
Mm-hmm.
As you know, I have been, and I don't know if my listeners know, I've been through both treatment for acute tick bite, potential Lyme and Lyme disease itself.
Mm-hmm.
I know you've had previously for me.
Yep.
And, I'm based in the Maryland area where Lyme is definitely prevalent, but nothing really compared to New York. People don't fear it or worry about it like we do in upstate New York, where you backyard and see grass and you're like, all I see is ticks, right?
Mm-hmm.
So I guess like a big question is who, and this could be everyone, who, when, where are the people most susceptible to tick-borne illness, not just Lyme disease, but Bartonella, all of the co-infections that can come alongside that, because people probably don't realize it's something to be concerned about in certain parts of the country.
Mm-hmm. So it's interesting. And when I refer to Lyme disease, and I refer to that entire umbrella of tick-borne illness. So it's interesting because we often think about, well, certain times of the year, we don't have to worry about ticks because they're sleeping or they're dormant. But that is becoming less and less the case, especially up here in upstate New York. My husband and I went for a hike, and there was some snow on the ground. And lo and behold, it's probably the only time I feel safe going out into the woods hiking. But there were ticks on some of the twigs and branches. So I feel like it's important to always be vigilant, regardless of what time of year. Always check yourself when you come in from outside. And I can go into a little bit more of the preventative strategies that we recommend. But interestingly enough, you think, well, certain parts of the country don't have a problem. It's not true. We were in Aruba on vacation a few years ago. Now, Aruba is a Caribbean island that is very, very close to the equator, where you would think probably not much can survive. My daughter saw a little puppy on the beach, picked up the puppy and was petting it. She walked over to me and I looked, and lo and behold, there was a tick crawling up her arm. So
it takes like 1 second. I got bit. And it's so interesting, right? Like, and we can talk about this too, the fact that people are like, well, I've never had a tick bite, right?
Right.
I previously, when I had been treated for a year for Lyme disease, I have never had a tick bite. I'm sure I have, right? In New York, I love to hike, dogs who always have ticks. I have family members with Lyme disease. And then after I finally was like, I'm feeling better, and I had fixed my gut up post-treatment, all of that. And then on my way home for my wedding during the pandemic, and I was maybe outside for 2 minutes, probably, I think in the New Jersey area, and looked down and I had a tick attached to my arm. So, it takes all of 2 seconds. I wasn't really like doing much outside.
Yep.
I have to get treated again. So.
Yep. No, it is. And I would say probably less than 50% of my patients who are diagnosed with Lyme ever recall seeing a tick on their person. These ticks are the size of a pinhead, and they're very fast. They climb up your body very quickly, and they like to hide in places that are warm. So that's why it's so important to make sure that when you are out and you come back in the house, take off your clothes, stick them in the dryer for 30 minutes. Ticks hate heat. And take a hot shower and check yourself. I always say, check yourself before you wreck yourself.
And in all those like little crevices, I have
Yes.
many in some weird places on my husband after golf.
Yes, that's a big one, golf.
Normally check.
Yes.
For
Yes. And if you're lucky enough to have a partner that you feel comfortable allowing them to check yourself in those areas, I mean, it's important. It is, because that's where they like to hide. I had a patient not too long ago. He had one actually in his ear canal.
Oh, that sounds brutal on like a lot of levels. Yeah. Matt is my husband. Sorry if he's out there listening to the story, that is too for my listeners. But he was, right? We did the quick check. Like, I was going out for the night, home from golf, and I did the quick check over, nothing there. And then the next day, he's very light, so there's like a lot of freckles and things. He was just laying on the couch and he saw something on his belly he thought was mole. And then he was like, I don't have a big black mole. And we found it and immediately checked and found about 5 more lodged in some interesting choice places. So that quick look is sometimes not enough if you've been doing especially outdoor activity. So check yourself before you wreck yourself. I like that. And I guess so, right? You don't need the tick, you don't need the bullseye rash, you don't need to have found, which is really important for listeners to realize. And this is the lengthy list of symptoms you can have with Lyme, and or obviously, right, certain symptoms can make you think about certain co-infections a little bit, but this will be a lengthy one for you to answer. But what are some very common signs and symptoms that people maybe have been struggling with long term that and
Mm-hmm.
don't check them, right? Because it's not
Mm-hmm.
checked often without that tick.
Mm-hmm.
So
Well, I think one thing too that's also important to remember is that not every tick bite is going to result in a Lyme diagnosis or a chronic Lyme picture. You know, we all have immune systems and we need to remember that. And if you have a robust immune system, oftentimes you could have mild symptoms or your immune system just deals with the microbe. So, but there are some of the classic Lyme symptoms, the joint pain, the fatigue, the numbness, the tingling, the brain fog. Probably the most persistent symptom that we see, and it's probably pervasive of the co-infections, is fatigue. Fatigue's a big one. The most concerning are the cardiac symptoms. So if you're having chest pain, heart palpitations, dizziness, and a heart rate less than 50, you definitely want to go get checked. Probably the most persistent symptoms are the neurological symptoms. The brain fog, the memory loss, the numbness, the tingling, and then there are some neuropsychiatric manifestations that can occur with like a Bartonella infection. So my recommendation is Dr. Richard Horowitz created a Lyme symptom checklist that anybody can access online. I think we even have it on our website. And that goes through just a myriad of symptoms that can be associated with tick-borne illness, but then it also goes into some of the risk factors. So some of the things that are risk factors, and I often ask my patients, well, do you sleep with dogs? Well, yes, if you sleep with dogs, yes. Uh-huh. Huge risk factor. Do you golf? Are you an outdoorsy person? Do you hike a lot? Are you a hunter? There are so many risky behaviors that that can increase our chances of being exposed to ticks.
yeah, I actually filled out back at a practice where I work. A coworker was wondering if they had Lyme. This was when we were newer into like working in an actual facility with like every kind of practitioner there.
Mm-hmm.
And we filled out Horowitz's questionnaire. We were both
Yeah.
like, okay, I've checked off way too many, and we both got checked, and we both had Lyme. So
Yeah.
it
Yep.
is a good checklist and kind of starting point if you're wondering if you should get checked. Obviously, I just think everyone should get
I
checked.
know.
It's like, why
Yeah.
not?
If you leave your house and
Yeah,
you don't have,
you're a
you
human
need to
being.
you need to get checked.
Yeah.
Yeah.
I guess so one question, because I actually don't remember the test name, but there are a lot of, I don't know if a lot is the right word, but there are different companies that you can send the tick after you extracted it from your arm or what have you, and send it out for testing. And I think some are even potentially free, or low cost. Can you speak to any of those that people do find a tick they could right before you have to jump on a month of antibiotics? You can sort of make sure
Yeah.
the tick has a.
So we really like Tick Report. So www.tickreport.com. And for literally $50, you can, within about 3 days, get a complete read of, what infections did that tick carry? Did that tick feed? Was there an exchange of material with the tick? That is a very valuable test, because when people pull a tick off of themselves, antibiotics need to be used. Antibiotics are effective, but they also need to be used in a way that, you can't just every time somebody gets a tick bite, give them antibiotics. That's not healthy either. So having that data, if your tick report comes back with, well, yes, your tick had Lyme, it had a Borrelia, it had Babesia, that kind of gives you the ability to have a more targeted approach, so that then you can appropriately treat the patient. And if the tick comes back clean, there's no need to use antibiotics generally.
Exactly. So when you have a patient come that has never had testing, right? Maybe they're wondering if they have Lyme, or they've had the test, but no one started anything because it's more a chronic case. What is your methodology for testing, from kind of starting maybe with like a LabCorp type of test, kind of more specialized tests? sensitive.
Yep. So we don't get too wrapped up in lab results, right? Because labs are not reliable when it comes to chronic illness, particularly tick-borne disease, right? So, we do a complete intake. We take a complete history. We also ask our patients to fill out on our portal. We have Dr. Horowitz's questionnaire. So we look at what did they score on that questionnaire? Do they have a high probability? Is it a low likelihood? We also then go through all of their symptoms. When did their symptoms start? We kind of do a full assessment of them that way. Then we do order lab testing. Generally, I like to order lab testing that's going to be covered by insurance. Treating tick-borne illness is extremely expensive because the insurance companies, as you know, don't acknowledge chronic Lyme disease for the most part. So we like to do as much as we can through the insurance. So we'll go to like a LabCorp or a Quest, and we'll order all the the tick-borne tests, all the different co-infections, and then there are some other markers that we look at as well. But again, none of them are 100% reliable. We look at like what's called a CD57 test. That is a natural killer cell test that sometimes can be suppressed in people that have chronic Lyme, but not always. And a lot of practitioners don't treat unless they have a positive result of sorts. We don't do that. So even in the absence of any type of positive serology, if the patient has every symptom, every lifestyle, variable that screams Lyme, we're going to treat. And we look at like liver function, kidney function. Certain co-infections can cause an increase in liver enzymes or bilirubin levels. So there are a lot of, we try to look at it from a lot of different angles.
Yeah. And with the treatment, this is hard, right? That's why seeing a Lyme specialist is so important if you are trying to combat Lyme disease or any of the co-infections. But there's herbal versus medication is a huge course. We could probably spend the whole day here. Do you have a preference? Do you like combination therapies? Do you try to start more natural, especially unless they're like super sick or it's more acute? I'm just curious with your approach on.
So every person is different, right? So there's not a one size fits all approach when you're treating tick-borne disease, because you have to consider the patient, and then you have to consider, the patient's issues. So some people do not tolerate antibiotics. For an acute Lyme diagnosis, generally I always go to an antibiotic or a combination of antibiotics just to treat that acute issue. But for chronic, antibiotics long-term are not always the best option. So oftentimes we'll use antibiotics for time, maybe in addition to herbs, or sometimes we use herbs in lieu of antibiotics. The benefit of herbs is that they have a very low potential of toxicity, right? And herbs also help to support normal gut flora, and they work with your immune system, whereas antibiotics don't. Antibiotics can significantly disrupt your normal gut flora, and they also have a potential for toxicity. And then there's also the potential of resistance. So ideally, we want to, look at where's the patient, in their, where are they in their Lyme disease? Are they in a chronic state? Are they in an acute flare? And then, what's their gut health like? Obviously, you know better than anybody what antibiotics can do to the gut. So we always want to make sure we initiate kind of oftentimes before I start treatment with antibiotics, I initiate some kind of a stabilization protocol just to make sure that, the damage that inevitably does result in the gut is minimal.
Love that. Yeah, I would say two of the sort of as that secondary party to the Lyme practitioner that I see, I think incorrectly happen often. And I'd love to hear if you agree with this, and sort of what you see with some colleagues is, one, I feel like a lot of people don't, right, this is chicken or the egg a little bit, but they don't focus on the immune system, because I do
Mm-hmm.
the time, even with gut health, right? You can have H. pylori, but if the immune system can deal with it, that's okay. If
Mm-hmm.
the immune system can't deal with something, that everything
Mm-hmm.
goes to crap.
Mm-hmm.
So I don't see enough, I think, support of the actual immune system. And
Correct.
gut health people do this too, right? They don't support the overall, and there's like kill, kill, kill.
Mm-hmm.
And then the bigger thing that I see, and this just might be due to my specialty, is that Lyme, right? So I say this about everyone, including when I used to work at an integrated practice. Like, for the most part, a Lyme practitioner is going to see Lyme. A gut health person is going to see gut, right? Like,
Mm-hmm.
rheumatology is going to see something going on there. So it's like you have to sort of take sometimes who you're working with a grain of salt. We'll play around with some other stuff, but you always like, it can always come back to this. And I see that a lot with gut health and Lyme disease, is that the practitioner just keeps going because the symptoms match Lyme.
Mm-hmm.
But of those symptoms can be overarching themes with gut problems and gut infection, the damage from the antibiotics long term.
Mm-hmm.
And they never run the full gut panel. They don't support the gut health and kind of fixing that. And I've had numerous patients that have been through like 5 years of Lyme treatment. They're like, I'm not getting better. I need a new approach. And the second I start to work on their immune and gut health, they're like, 90% of this is better.
Mm-hmm.
So it's just something I see, obviously the work of Lyme is so important. I know firsthand. But I wish more people would get more education in the gut health department and treat Lyme disease, because I think there's a lot of damage that gets done and never fixed.
Absolutely. And I also want to go back to the point that you made earlier about, how a lot of times Lyme practitioners, they see everything through a Lyme lens. Well, that's again, and not to reference Dr. Horowitz, but he was a pretty big influence on my career, is he has this multisystemic infectious disease model. So that model enables us to look at not just Lyme and tick-borne illness, but are there viruses? Is there a mold toxicity issue? Are there heavy metals involved? Are there vitamin and mineral deficiencies? Are there hormonal imbalances? Are your adrenals shot? There are so many different variables that either result from an illness, a chronic illness, or are contributing to it. And I think that a lot of times, like you said, in the Lyme world, we look at things through a Lyme lens. We have to look at the whole picture. We have to address the patient as a whole. Dr. Horowitz often says, if you have 16 nails stuck in the bottom of your foot and the doctor removes 12 of them, well, you still have 4 nails in there and you're still going to be in pain. So you have to look at all the different nails.
Yeah.
And the gut I always tell people, the gut is the epicenter of everything. And if your gut ain't right, you ain't right. It's just, it's just a fact of life. And that doesn't just apply to chronic illness or acute illness. That's just general health and well-being.
And a lot of people with gut issues cannot have, right, the symptoms of gut issues. They could have the fatigue and
systemic,
and all these things that literally can mimic Lyme or worsen Lyme and the response to Lyme. So it's so important. And like for me, one of my specialties within gut health is small intestinal bacterial overgrowth, and over 60% of Lyme patients have SIBO.
Of course they do.
Right? That's a high percent. And if you're not working with either a Lyme literate physician or a nurse practitioner, PA that also is very educated in gut health, you need to also be working with a gut health specialist.
Well, and that's the thing, the microbes can disrupt the microbiome, but the antibiotics can as well. And we know that's makes you rife for SIBO. And SIBO causes a lot of the same symptoms that Lyme does systemically. It's crazy.
That's a little crazy with those two. And obviously there's some distinguishing factors, but many of the symptoms honestly overlap with those. You get that double whammy, plus often, obviously, with repetitive antibiotic use, you're going to get yeast overgrowth, and then treating all of these things just gets harder and harder because they start to support each other's growth and make it harder with their biofilms and
and they just have a big old party in your body, and it's
I I'm glad to hear you agree. And it's why like working with someone like Jen, everyone is amazing because she has that education and everything. And I do think there's a difference. I see in the social media world a lot, people like, no one cares about your degrees. And I'm like, you should, because you should care about that extended
Right.
education that people are seeking
Yeah.
out. You are doing the A4M, doing the IFM.
Mm-hmm.
That's where you learn, honestly, outside of experience, you are
Mm-hmm.
those connections outside of just your specialty and kind of,
Yeah.
at least I believe, a lot of what I saw. And I remember sitting in you many years ago at a practice you worked at. And I remember you did, so like diet was big, of course, it's big in everything.
Huge.
But I remember you talking about gut health a lot. And I believe a lot of the diets you do or did back then were obviously to prevent inflammation.
Mm-hmm.
B, though, was a lot of like yeast and
Mm-hmm.
bacteria overgrowth. So it seemed
Mm-hmm.
like it was a lot of like gluten, dairy, sugar free. But I don't know. Obviously, it's independent to the individual. Do they have SIBO? All of that. But
Mm-hmm.
is there a general guidance you give to every, Lyme patient for
Mm-hmm.
using every loosely here?
Mm-hmm. Yeah. So what generally we always recommend is that sugar has got to go, right? When you're treating any type of a bacteria, virus, fungus, anything like that, cancer, you always want to make sure that you're not feeding what you're trying to kill. So sugar is a big one because sugar feeds bugs, feeds all those things that we don't want in our body. So I always tell my patients, your house is on fire, and your house being your body. I'm the fireman. I'm going to try to put that fire out. But if you're in the back room pouring gasoline on it, even just a little bit of gasoline, I'm not going to be able to put out that fire.
I like that.
So, and then obviously we look at foods that can cause inflammation, like gluten and dairy, and particularly foods that can cause inflammation in the gut and also promote aberrant overgrowth in the gut. So generally, I recommend a paleo type diet. Always making sure that people realize that a paleo diet does not mean, a meat laden diet, but eating a lot of good nutrient dense fruits and vegetables, and just staying away from processed crap, and sugary foods.
Yeah.
And then the question is always, well, can I have fruit? Well, yes, of course you can have fruit, but you can't have a big old glass of fruit juice,
No.
right? How many oranges does it take to make 8 ounces of orange juice? You'd never be able to eat that many oranges.
A lot of
So, yeah, but I think just a really good, clean, but there's a huge learning curve with nutrition, unfortunately. And that oftentimes presents a huge challenge for patients, is but just the diet alone, if people are compliant, I'm telling you, I've seen up to 50 to 60% improvement in their symptoms just from diet alone.
I know. It's fascinating, really. And obviously, it's not always the full answer or even potentially even going to make a difference, but it does for a lot of people. The second you stop feeding the things, right,
Mm-hmm.
growth and energy, and you start to reduce that inflammation, right, the joint pain's going to lessen, the fatigues,
Yes.
all of
Yep.
that. So there's so many versions of just, and start small. If it is a learning curve and you are exhausted even just by this conversation, be like, well, I can't do that. I can't do paleo because paleo is overwhelming to a lot of people. Just start with not eating things in a package, right?
Right.
That.
Exactly. Things that live on shelves are generally meant for shelf life, not human life, right? And I always encourage patients, if they are able to financially, to work with somebody like yourself, so that they can get that nutritional guidance, and they can have somebody there that can help to kind of implement some of these changes so that they're not too disruptive in their lifestyle.
Yeah.
Um,
And
we
we
work.
got honest truth, like for anyone who's not ready to commit, like maybe financially they aren't able to do that, but with working with Lyme practitioners, we have like individualized programs that we put out that you can purchase, we have like an elimination diet one, and it kind of walks you through that on your own and gives you like 80 recipes and all this stuff. So it's a really good stepping stone for people.
That's great.
Yeah, and we've been doing like a keto, I mean, we actually starts today, keto program, which is super great for Lyme, I think. But like a lot of versions of that, and truthfully, our programs are like $50 for you to get through on your own. So If you,
Yeah, that's great. You guys are awesome. I mean, the work you do is really incredible, and I have so much respect for it. And it's so important.
thank you.
Yeah.
I do that on this Monday. But yeah, there's a lot you can do. There's baby steps you can do to just even make a big impact. And once you make small steps, everything gets easier, right?
Mm-hmm. Yep.
It's
Yep.
super easy, and it doesn't have to be like a life sentence of you can never have a piece of cake ever.
Right.
And it's just kind of the 80,
Yep.
20, 90, 10 rule. If you get it.
Yes,
Yeah.
absolutely. But again, when you're when you're undergoing treatment, and I always say this, you're when you come to me, it's generally because you're desperate,
Yeah.
because you have not gotten the care, the treatment that you've needed to get better. So when you're sitting in my office, you're usually patients are at the end of their rope and they're willing to do whatever it takes to get better. But we also don't want to torture them in the process by taking away every single thing that they love,
I know.
because they've lost so much already with
I
just this disease. So
Lyme really affects it affects everyone, right? It affects everyone.
everyone.
And it's just not a good time. I mean, um, I guess one thing I find really interesting, and I wonder what your recommendations are the lifestyle things someone could have access to, whether I don't know what you carry in your practice or at their house, like there are
Hmm.
like portable saunas and things like
Hmm.
that. Obviously, there's going to be like this is the gold standard of sauna, but anything's
Right.
support you. So, like, what are your most recommended lifestyle additions from red light therapy? I know is great.
Hmm.
What do you for Lyme?
So infrared saunas are awesome,
Yeah.
right? They can really help they're awesome for detoxing metals, heavy metals, things like that, mold. They're great for reducing inflammation, and they're a dry sauna. So they're generally better tolerated than kind of the sauna at your gym where, you're just sweating profusely. And I mean, a lot of people can't tolerate that.
Yeah.
Um, but and a lot of people can't afford to go to a place, where they can have a sauna 2 to 3 times a week. So, and they can't afford to have one in their home. Although there are some, they're being made much less expensively now, so that people are more able to have them in their homes. Epsom salt baths is,
Yeah.
that's a great alternative as well. Um, and hyperbaric oxygen therapy
There's
can
just
also be helpful.
on that.
Yeah,
Huh.
yeah. It can be it can be a really, really helpful treatment modality for tick-borne illness. But again, none of these, I mean, these are all great supportive therapies. And I think when you kind of, you put the whole picture together, you have the treatment, you have the, kind of supportive therapies, you have the nutritional
Mhm.
therapy, and then exercise also. Even if it's just literally walking around your coffee table
Yeah.
twice, if that's all you can muster up. But I always tell people, don't over exercise, because we know exercise is a stress on the body. It's a good stress and a necessary stress if you're healthy. But oftentimes, we just want to get that blood flowing,
Yeah.
and sometimes exercise can help with the fatigue. But
Yeah.
sometimes patients are so exhausted they can't even muster up the energy to lift their head off their pillow.
I'm gonna say the
So
hardest part is when you have someone so exhausted, which or in pain that Lyme can do. I know that I've had pain most.
hmm.
Um, they don't want to exercise, right? Because
Right.
it's more pain and especially someone like for me, for example, right? I was a Division I college athlete. Plus, I've been in pain since I was like 16. It's like so you have someone like me, meaning I don't know how to now I do in my 30s, but I don't know how to just like casually go for like
I know.
you know what I mean? It's like all or nothing. So then
Right.
you feel like crap. It's just like this vicious cycle.
Yeah.
But right, getting that lymphatic tissue moving
Huge.
is so underutilized and so huge because it's like you can't really heal if things are stagnant.
That's
Um,
right.
how do
My
you?
other favorite thing is low dose naltrexone.
I tried that for a while, but that's like a game changer when for some people
Huge.
and nothing works, right? It can really
Mhm.
that magic answer.
But it's even a great, I mean, I use it not as a last resort. A lot of times I use it as a first or second
Yeah,
resort. But, you know, look at you, Division I college athlete, Lyme disease, you know, you've had pain since you were 16. Imagine how you would feel if your immune system were compromised, or if your diet was crap, or if you weren't taking care of yourself like you do. You
Yeah.
know, I mean, it's, and that's where I think a lot of this is education, just educating people and how they can improve the quality of their life by just making some simple changes, taking, you know, making sure their vitamin D levels are optimized. That is huge.
Yeah. Yeah, and it's sad because, I mean, obviously you can't generalize everyone, but the traditional healthcare world, right? What we do is still traditional components, just seeing the whole picture on somebody. It's really an approach to
Right.
versus some like, I don't know, people always think of functional medicine, which is so incorrect, as like this like voodoo, you know, super hippie stuff. And it's like, it's not, it's just the way that you approach the body and the treatment of a patient and kind of
Correct.
compartmentalizing something versus holistic approach.
Right.
But our whole traditional healthcare, we don't have any training in any of this. It's great. Like, right, our go-to Lyme specialists, if you will, are mostly physicians and traditional Western medicine physicians who have maybe one course in nutrition, and the nutrition taught is wrong. So how do we expect the average individual who's getting that kind of help to feel better? You know, it's kind of.
Well, and you know, to their credit, I think the majority of physicians, you know, do truly want to help their patients, but they don't have the luxury of spending 2 hours
No.
with their patient to do a complete holistic intake. You know, and you're right, we do have kind of that stigma in functional integrative medicine. I had a good friend of mine who lives in Chicago, and we always banter back and forth, and he said, are you working tomorrow? And I said, yeah. He goes, okay, so you're going to be rubbing granola bars on people all day long. You know?
I have a pet peeve around it, but this is me digressing a little, but I see practitioners that I'm even, right, like I run in circles with, and they're great practitioners, and they will kind of like be in their social media outlet kind of preaching like functional medicine, just the negative aspects where and it's sad because there's no education on their part as to what functional medicine really is. In my opinion, anyone that truly understands it would understand that there's nothing crazy. It is completely science-based. It's really just a different approach, if you will, and kind of attack on the the patient case.
Well, it's science-based and it's patient-centric,
Yeah.
right? And it's not a pill for your ill. It's really looking at, you know, how can we optimize I mean, we have more pharmaceuticals available to us today than we ever have, and our population in this country is sicker than it's ever been. So I think there's a disconnect there, you know, and I always say healthcare today doesn't have much to do with health or care anymore. It's, you know, it's unfortunate.
Yeah. And each medication is going to cause another problem that you get a medication for. And
it's like playing whack-a-mole.
Yeah, it's really, it's sad. I think we'll get there. It's just, it is, right, it gets to a deeper issue of like insurance and education, and
that's the issue.
Really deep down. But I like those I do like red light therapy a lot for people, because that's something relatively inexpensive that people can get. I mean, nothing's inexpensive, but that they can get at home. And small panels, whether it's just like a facial light to a whole body thing, and it doesn't take up much space. I would always say the infrared sauna would be the go-to for Lyme, but I think you can't afford that, or you don't have, like, I don't have space to buy my own
right
sauna.
Or you can get the Jiffy Pop version, right? You've seen those at the conferences.
Yeah.
But they work. They're great.
They work. We sell them on our website, actually, and we've had some people, and like after 1 or 2 tries, they were like, I already am feeling.
Yeah.
So they do work. Obviously, they're good portable options that like you can have up in a small room, or you can put in a closet. So if you are interested in those, we do sell those, which have been super great.
That's good to know. Yeah, they're great. I really like those. They're affordable and portable.
So outside of some of, obviously this comes down to, right, what is your immune system, your gut, your what are you testing and who are you working with, like diet, that care, supplemental care. But what can people be doing to really support the prevention, whether it's not getting bit by a tick, period, or what happens if I did just get bit by a tick? Because that's where it all starts, right? And people don't really know what to do.
So number one, don't get bit by a tick, right? Wrap yourself in saran wrap anytime you leave the house. No, I'm just kidding. But if you're out and about and you're hiking and you're in the woods, I always tell people bring one of those adhesive lint rollers with you, and like every 15 minutes, just roll your pants, just to see if you're in a kind of a tick endemic area, and tuck your pants into your socks. Wear your just literally, you're be a fashion faux pas when you're out there hiking,
Possible.
What's that? Yeah,
That
look as hideous as you can.
Yeah.
Yeah.
Everything to everything.
Yeah. Look so hideous that not even ticks want to get near you. That's that's the key. So then when you come in from being outside, obviously take all of your clothes off, throw them in a hot dryer for 30 minutes, take a hot shower, check yourself visually and everywhere that you can. And then there are also things that you can do while you're hiking. So there are tick repellents. So there's permethrin, something you never want to spray on your skin, but it's great for clothes and boots. Just don't bring those clothes into the house. And I always recommend kind of making those be your outer layer of clothing, and keep those in the garage or somewhere. DEET, obviously, also you can spray on your skin, but it's very toxic. I don't recommend it for people that have compromised immune systems. And then there are a lot of essential oils and things that are effective, like cedar oil, geranium, things like that. And there are a lot of good blends that you can buy. So making sure that you've got that additional layer of armor, that can also help. But
are there any specific like natural blends you like that people can look up online?
There are a lot of them.
Yeah.
There's a local company here called the Rad Soap Company. They're great. They have.
You should know of them. I talk about them a lot.
Oh, do you? Yeah.
I haven't talked about their repellents, but I've talked about their skincare.
Yeah, well, their repellents are awesome, and they're safe enough to spray on an infant. They're safe enough to spray on your dog. But again, the natural stuff is great, but you've got to make sure you reapply it every couple hours, especially if you're sweating. And then as far as your immediate environment, your lawn, I don't even step on the grass anymore outside. But we have like 800 deer that walk around our property. So, but you can get tick tubes that you can put around the perimeter. For people that have kids, and you want your kids to be able to play outside in the backyard and on their swing set, you need to make sure that your environment is as safe as possible. So again, cedar oil. There are a lot of companies out there that will spray natural cedar oil on your lawn. It just needs to be reapplied after a heavy rainfall or two. Little tick tubes that you can. What's that?
I'm asking for personal.
Yeah,
I'm gonna get whatever.
There are these little tubes that have like a material on the inside. They almost look like toilet paper rolls. They have like a cottony material on the inside that has that's treated.
Yeah.
So that you can kind of put that around the perimeter of your house and your yard. The other carrier of ticks are mice. Mice are we just think of deer. Well, the mice are almost worse. Deer don't generally come traipsing through your house, but mice often will, and they can carry a lot of ticks.
Yeah.
And then again, it's not just ticks that carry these diseases. We're talking mosquitoes, and it's.
No one's safe.
I mean, no one is safe.
No
longer safe.
It's safe.
Stay in your house. Do not leave your home.
Yeah. This is interesting, though, not to circle this because I tend to avoid this conversation in my podcast and care, but circling sort of even to like the pandemic and COVID right now is just like the amount that people aren't focusing on the preventative of immune and nutrition care things, right? Like not all of us can just bundle ourselves head to toe, saran wrap, never go outside, especially feel your best in nature. I know that's been a problem for my life, and But then what are we doing at home? Do you know what I mean? What are some simple things we can do at home to be supporting outside of the nutritional aspect and stress reduction? Like, are there a couple supplements or things like, or specific foods you like for people just to support natural immune care? So if they do get
Well, obviously, nutrient dense foods, buy as organically as you can, you know, pesticides, herbicides, fungicides, all those things that are on conventional vegetables and dairy products and meats, and go as organically as you possibly can. No, that's number one. So that also minimizes the burden that your body has to deal with. Vitamin D is huge, and some of the studies are coming out now that are showing that optimal vitamin D levels are associated with less complications with COVID.
Yep.
Vitamin D is so important. And if there's one supplement that I would recommend for every single person on this planet, it's vitamin D. Obviously, you want to make sure you have your levels checked. But it's, I'm talking like an optimal level, which is between 60 and 80, not when you go to the doctor's office and your vitamin D is 31 and they tell you it's normal.
Like when you get your lab and it says it's 35, you're
yes. Yeah, you're
so
still low.
Not good enough.
Yeah, well, that's the other benefit with functional medicine. We look at labs completely differently. We narrow that range for most lab values.
Yeah.
And but optimal vitamin D, number one thing you can, and then sleep. Restorative sleep is huge. Your immune system cannot function properly if you're sleep deprived.
So,
right.
I got the Aura ring. I'm liking that.
You like the Aura ring? Yeah.
I like it so far. I have had to take it off recently. I don't want to stress myself out too much with it, but I was hearing some people were like, both COVID and Lyme were kind of like self-diagnosing something was off to go get checked. And lo and behold, they had XYZ infection because of their Aura ring. I thought that, but I can also see how much it increases people's anxiety.
Yep. I had one and I ended up giving it away because I was becoming obsessed with what was going.
Yeah, it can really, it's great for a lot of people, but if you're one of those like health anxiety driven or like fixated humans, it might not be worth it. So I have to kind of like monitor myself.
Yes,
absolutely.
Yeah, but it's a very cool device.
It is a cool device. It can tell you a lot. It can give you, and it's an interesting thing you could use for like, even if you're trying something new for restorative sleep, just to see if it is working for you. But like sleep hygiene is huge, and everyone has such happy sleep hygiene, I think.
Yes, and sleep hygiene is key. Yeah. And there are so many things that we can do to help support adequate sleep hygiene and help to support that sleep, an optimal sleep cycle.
Yeah.
Outside of, the Ambiens and the Unisom and all those things.
There's a lot you can be, and obviously a lot of that actually starts with the stress and the diet, right? And gut health not waking you up and circadian rhythm, but just as simple as like, I remember my sister's a psychologist, and I remember she one time was like, the bed is meant for sleep and sex. That is it.
It's true.
It's no TV, no reading, even just read on the couch and then move to the bedroom. And I don't know anyone that's doing that, right? People are on their phones, they have the TV up, they're reading all night. And it's really detrimental.
It is. And I do know people that keep all of their electronic devices out of their bedroom and but most of us don't. We use our phones as alarm clocks now. And I know my husband, the first thing he does when he wakes up in the mornings is he grabs his phone and starts reading the news, which in my opinion is the worst way to start your day, especially nowadays.
Get cortisol going, which is good in the morning. It's true. We've been trying. We got like an old school alarm clock and try to keep it on, but I still have the habit of it's there. I'm falling asleep to it, or it's not great. Is there anything else that's a big component? Obviously, this is a more generalized Lyme talk, but like a big component that we're missing for Lyme treatment prevention?
Well, I think the biggest component that we're missing is adequate testing, adequate diagnostics. And I think that, there are just from, what I'm hearing out in the
Mhm.
scientific community is that we're pretty close to having some better testing available, which is exciting and encouraging.
Yeah.
Because once we have better testing available, it's going to be more difficult for, mainstream medical docs to deny the diagnosis.
Mhm.
It's if we can get a diagnostic, then that's also going to make it more difficult for insurance companies to deny treatments, right? So, and then I know a lot of people talk about the possibility of a Lyme vaccine. I don't see that happening anytime in the near future. And Dr. Horowitz once told me that, he thinks the vaccine should be against the tick's saliva, which makes more sense.
Yeah.
Because if you have a vaccine against just Lyme, well, what about all the other co-infections, right? And, I think that diagnostics, that's
Yeah.
number one.
Missing key.
That's what we need. We need more funding. We need more research, and unfortunately, the focus in the last year anyway has been
Yeah.
COVID. It's been all about COVID, but it's amazing how quickly they were able to develop a vaccine.
Yeah. It's crazy times, crazy world. I hope that testing comes out. That would be hopefully a game changer in the.
It would be a game changer. Yep. I mean, there are better tests available,
Yeah.
certainly with specialty labs, but unfortunately, again, it comes back down to cost.
Yeah.
Most of them are not reimbursed by insurance companies, and they're costly.
Yeah.
I like IGenics Labs out in California.
Yeah, that's the one I
They're
did.
great, and I love Armin Labs in Germany. He's, but unfortunately, New York State doesn't allow us to. New York State prohibits us from ordering a lot of functional testing.
I know. If anyone in New York is listening, fix that, because
Yes,
I'd like to move back and
I'd like you to move back.
I want to come there and I get jealous of everyone in New York, but the rules there are kind of unfair to healing
They
people.
really are. Some of the best gut tests.
Yep.
We can't do in New York.
Yep. I know.
And I don't know why. What's the big deal?
I don't know. I think that will. I really do think some of that will. I don't know necessarily about Lyme, but I think some of like the gut stuff, and we'll keep expanding. I hope there, and then be your neighbor when that happens. So
that would be great.
And then, are there any good books or podcasts people should listen to that might be struggling with Lyme?
Great. There are a lot of great books out there. Bill Rawls has a couple of books that are very good. I love Dr. Horowitz's Why Can't I Get Better and How Can I Get Better? Those are great resources. There are a ton of good books out there.
Yeah.
And there's a lot of great information on the internet, but buyer beware.
Yeah.
The internet can be a very crazy place, especially some of the social media groups, the Lyme support groups and things. I think it's important to really remain vigilant and discerning because there's a lot of advice out there, some of it good, some of it not so good. And and you have to remember that everybody's story is unique.
Mm-hmm.
Someone else's story is not going to be your story and vice versa. This is a very individualized disease and treatment process. And, we have to remember that, just because a certain therapy worked for 5 people on the support group does not mean that that therapy is going to be appropriate for you.
They need to get themselves an amazing practitioner like yourself.
Oh, you're so sweet.
And so tell everyone where they can find you and your social media that is going to start booming so they can all get the right information on social media.
Well, I need to figure out how to turn my phone on and off first before my,
But
Synergy Integrative, it's spelled SYNRG Integrative. The RG stands for Ruiz and Goldstock. My partner, Natasha Ruiz, in the practice. She and I have been working together for about 8 years. She sees all the kiddos. Mm-hmm. And for those of you who have kids, it's important to make sure that you have a practitioner that is Lyme literate and also specializes in the treatment of children, because there are a lot of differences oftentimes between treating adults and children. We're in Latham, New York. and we're still accepting new patients. And we're social media. We have Synergy Integrative. We have a Instagram site, and then I have my Jennifer Goldstock NP Instagram as well. That's going to be ramping up here as soon as I.
Everyone have to follow her. I'll share it in case you need to find her, and then I imagine in your Instagram they can find the link to your website as well if they're.
I imagine they will be once that all gets set up. I always tell Katie, her social media is amazing, and I barely know how to post a picture on mine, but I've now hired somebody to help me with that. So
learning curve. It's a world. I don't know how anyone does it. I'm exhausted doing it on my own.
Yeah,
but had a hard enough time just getting on the podcast.
Well, but you're young and hip, and you know how to do all that.
You'll get there. Okay.
That ship has sailed for me.
People. So this has been awesome. Is there anything you have, last comments you want to make to our listeners, or questions for me?
I think that, when you're looking for a Lyme literate practitioner, go to the ILADS website, International Lyme and Associated Diseases Society. Locally here in New York, the Lyme Action Network is an awesome resource for not only providers, but information on anything, testing, prevention. They have a really wonderful publication that they put out that is free. And those are probably, the two resources. And then there's LymeDisease.org. There are a lot of great organizations.
Yeah.
But the key is finding somebody who is Lyme literate, who is trained through ILADS, and then somebody that will work with an amazing gut guru, specialist, nutritionist like yourself, because I'm telling you, 50% of it is nutrition and gut, at least 50%.
Yeah. Well, we're accepting patients too if you need to co-work.
Yes. Oh my gosh. No, I mean, and you do virtual, right? So
yeah, completely virtual right now, and probably the foreseeable future. So it's been great, and we're happy to work alongside it and leave all the Lyme to the specialists and kind of just support you through constant nutrition, gut, and immune support, and work together. So
that's so awesome. And
but it's been
thanks for having me.
Yeah, I'm so glad we could catch up, and everyone's gonna be really interested in this because I just don't think there's enough education or proper education out there about Lyme, and I hope a lot of people share this one.
Yeah. Well, there's a lot of information out there, and a lot of great providers all around the country that are willing to treat. And just remember, it doesn't matter where you live in the country, you are not immune to Lyme disease. It's everywhere.
I know. Even here in Maryland, like my husband will be like, we don't really have it. I'm like, oh, we have it.
Oh, yeah. No, California. My parents live in California. They have a huge problem with it out there.
So don't ever rule it in or rule it out when you start to work on your chronic illness. It will honestly change the way you're being treated and the way you feel. So I think it's a really easy, affordable test that you can start with just through LabCorp. And that's where I started. Yep. And you can kind of run the CD57 too if you want alongside it, just to see how well maybe your immune system is dealing with things. And it can kind of give you a starting point. But then find yourself, this is chronic, an amazing practitioner, and they will help guide you. So thank you so much. Thank you for listening.
Thanks for having me.